Okay, I'm going to quickly explain to you about how the brain interprets pain. Okay, so number one thing, if you injure yourself, you're going to get a little bit of fear, you're going to get a little bit frightened, and you're going to be sore. So the brain has to interpret this and all the environmental factors around it to give an output. Now, in the instance when you have an injury, the output is going to be pain. So what we have to see is the brain has two decisions to make. One, is it going to be safe? Or two, is it not going to be safe? If it is safe, it doesn't give you any pain. And it interprets this by the injury and what you're experiencing when you put your weight on the ground. So does it feel a little bit shaky or a little bit uneven? All right. So what you've got to figure out then is with the pain that's proceeded beyond kind of normal healing patterns, kind of like that niggly pain in your back that doesn't really go away, that should have healed in a normal healing time, which is like 4 to 6 weeks. So what you have is you have your pain drivers. So number one, this is going to be all your emotions, you're going to be your previous learning history and what kind of fear. If you have fear of an injury, you're not going to move right, so you're going to compensate. So it's much like a limp when you injure your ankle. Now you're also going to be quite anxious about this. You're going to be thinking, is this going away? Is it not going to go away? So number one, you will have had the injury, and next thing you will have had all the pain, but then after that, it's what's going to last after the healing times that's going to be the most concerning. And what happens with all of these, with the pain and what your brain says it's safe or not safe, it increases your sympathetic nervous system. Now this is a nervous system that was kind of like, it's your fight or flight hormone. So a fight or flight kind of system. So it increases your adrenaline. Now this was used back in the older days when we had to run away from the saber-toothed tiger, but nowadays we don't have to do that. So we have different factors that are going to increase, like just like stress, financial worries, anxiety towards kind of not getting sleep or getting too much sleep or sleeping in. And what the physio can do from that, and what we can kind of try and determine from what factors are influencing your pain, is we try to decrease this nervous system as much as we can. And this is all about making your brain feel safe. All right, if it doesn't feel safe, sympathetic nervous system kicks in to try and protect itself. If it does feel safe, then it starts to calm down. Now there's a number of different things that you can do with that. Yes, you have a little bit of hands-on treatment, but then if I explain the injury to you a little bit better, then it's going to kind of put your mind at ease, kind of go, all right, hold on, it's not as bad as what I thought it's going to be. And this is what the physio said, it's going to be maybe 4 weeks or 2 weeks or 3 weeks that it's going to get to settle down. So what happens there is you do a little bit of hands-on treatment. It makes you feel that joint can move or that knee can move a little bit better. You explain the pain, so it reduces down your anxiety towards it, so you start to feel a little bit better about it. But also what happens is, instead of doing the massage, you have to strengthen it. So what that does is it reduces the compensation and increases your confidence in that limb. So when you come out of the physio, if you've just got a massage, yeah, look, it's probably going to get sore again later on. But if you got a massage and you got 1 or 2 exercises that kicks in a couple of different muscles and tells that brain, hold on a second, it's safe to put weight down through that knee, everything's going to start to feel a little bit better. Now what happens is when the pain comes back is you do something silly, like you go out for too much of a long walk and your brain's not able to contend with it, and your knee starts to get sore, you start to compensate, the fear starts to creep back in, the uncertainty starts to creep back in, and then all of this goes around in this circle of death, basically, to put it in a kind of an exaggerated context. We want to be able to break that chain where it circles, where you get an injury, you get pain, you fear for it, you compensate, and then you compensate and the pain gets worse. So what we do is we try to release all the muscles, give you a little bit more confidence, give you some strengthening exercises to give you a little bit more as I say, confidence in that leg, and then hopefully your pain should settle down with those. But the more you teach the brain that everything is safe and you're able to move, then your compensation starts to settle down. You kind of accept, okay, I'll have a little bit of pain, but pain is normal. Pain is just an alarm system to tell you there's something wrong. So just a couple of takeaway points from that is that pain is there for a reason. There's always a reason for the pain. If you have that niggly back that's just been sitting there and it hasn't been going away, there is a reason for it. Whether it's coming from your hips or it's coming from your knees, or your hamstring is too tight, or you're cycling too much, there always is going to be a reason for it. And you can always relate it back to the simple hypothesis is that brain, does it feel safe? No, it doesn't. It's going to give you pain. Why is it giving me pain? Because I'm anxious, or because I'm fearful, or because I have an injury. This is completely different now. If you break your leg, that's going to be sore and it's going to take a little bit of time to heal. But if you have those injuries that's kind of going, all right, this is going on a couple of weeks, it's like a scratch in your hand. After 2 or 3 weeks, it's going to heal, but it still feels a little bit sensitive around there. That's where we come in and we try and make a bit of difference with it. So that's the explanation of what we do. The ideas of what we try to achieve through some of the treatments that we do is trying to make you feel safe, trying to feel you can put more weight down through that leg. Once we get that pain reduced, then we can start to strengthen you as much as we can, and that's by, yes, using a little bit of weight and maybe getting you to hold in a certain position so you can actually put down some weight and gain a little bit of confidence through that leg. But it's all going to be in a safe environment that your brain thinks it is safe. If it feels it's not safe, then that pain is going to increase quite an awful lot. All right, send me a message if you have any questions with it. Okay, thanks.